Hello, I'm Dr. Beth Bartlett, and I'm a functional medicine practitioner in Northbrook, Illinois. You may be wondering what functional medicine is, and it is looking at the underlying root cause of disease. It involves understanding the genetic, lifestyle, and environmental factors that can be contributing to the chronic disease, such as stress, toxins, allergens, infections, trauma, and so forth that could be a part of your story or in your life experience that may not have been uncovered or talked about before. We address lifestyle factors such as food, sleep, movement, community, connection, meaning, purpose, and really focus on involving the patient in their care. Mainstream medicine does a great job at hitting the bullseye, if you will, and looking at that target diagnosis. You know, you've got XYZ, and so therefore we're going to do this or that. I call it Bullseye Medicine, but they're really good at naming and blaming versus thinking and linking. And I think that's a term by Dr. Mark Hyman, who is one of my mentors, and he's a really good resource for functional medicine if you want to look him up. But we look at all the factors around that bullseye or around that target, like I mentioned, such as pH and inflammation and hormones and digestion, and the list goes on and on and on. And I kind of think about things it's called the disease model, and really what it means, what it says, dis-ease or lack of ease, if you will. And there's kind of three parts to it. And the first part is you're kind of just feeling not quite right, but can't really, verbalize what's wrong, but you just don't really feel right. The second phase is you have actual symptoms, but no known cause. And the third phase is the actual, what we call the blood phase, where things start to show up in the blood work. And so that's where mainstream medicine really shines, and you wait for things to show up in the blood work, and then we'll treat it. But functional medicine really is about treating things before they become a problem in the blood work, if that makes sense. So we're getting to things, as I say, before they become a problem. So many things can be causes, and many causes can be conditioned. And what I mean by that is one condition can have many causes. So for example, if you've got depression or anxiety, you can have many causes for that. It can be low thyroid or vitamin D deficiency or omega-3 or omega-6 deficiency, essential fatty acids. It can be antibiotic use. It could be blood sugar imbalance. So you've got many different areas to investigate there if you've been, quote unquote, diagnosed with depression. And at the same time, you can have one cause and many conditions. So let's say, okay, you do have depression, but the real underlying issue is inflammation. So you can also have heart disease or arthritis or diabetes. And the real issue there is that we need to investigate is inflammation. So it's functional medicine is kind of like being a detective. And that's the part I really love about it. I love getting to know people, getting to know their story, and figuring out what is deep down inside, and what do we need to address through, talking or doing some additional testing and things like that. And history, past medical history, family history, very, very important in terms of what you might have been exposed to as even a young child, or if you had a traumatic birth, what your mother's health, biological mother's health was when you were born, and so on and so forth. So all of those things are really important when addressing patients, functional medicine patients. So I hope this is helpful, and please reach out if you have any questions. Thanks so much.